Hello everyone, Dr. Srilakshmi here from Pacesdiaries team. Today I'll be teaching you examination of cardiovascular system examination. Now cardiovascular station, you have a total of 10 minutes, 6 minutes with the patient and 4 minutes with the examiner. Now as you enter the hall, the first thing you have to read the instruction, sanitize your hands, introduce yourself and take consent from the patient. Hello, Dr. Srilakshmi here. I'm one of the PACES candidates. I would like to examine your heart. I hope it's okay with you. If there is any discomfort at any point of time, please do let me know. Next, you have to go for, after taking consent from the patient and introducing yourself, you do a quick general survey of the patient. Look for any marfanoid habitus, look at the facies of the patient. Just a quick survey of the patient. Next, you need to examine the hands. Look at the hands. As you can see, this patient has evidence as clubbing. You can see there is pan-digital clubbing, both the hands. Look for clubbing for the feet also. This patient has clubbing of both hands and the feet. Also, turn around the hands. Look for any features of infective endocarditis like Osler's nodes, Janeway's lesions, any splinter hemorrhages or embolic infarcts. This patient doesn't have any of those. Next, take permission from the patient. Can you please look up for me? I'm checking for pallor or even congested eyes. As you can see, this patient has a ruddy conjunctiva, or it just looks a little congested. Ask the patient to look down. Can you please look down for me? Yes. Can you please stick out your tongue? Can you please put your tongue up for me? I'm looking for cyanosis. This patient has central cyanosis. As you can see, the bluish coloration or discoloration of the mucosa. Next, most important, I would like to check for the pulse of the patient. Carefully check the radial pulse for minimum of 15 to 30 seconds. I am checking for the rate, rhythm and volume. Next, I would like to check for collapsing pulse. Always remember to ask for shoulder pain before you check for collapsing pulse. I hope your shoulder doesn't hurt. Next, for checking for collapsing pulse, you need to keep the base of your metacarpals over the radial and one hand over the forearm. Ask for shoulder pain, keep the arm straight and give a lift. You can feel the thud impulse on your forearm. Gently put it back. Thank the patient. Thank you. Next, offer to look for radiofemoral delay with the examiners. Also, check for radial delay. Next, most important, you need to check for JVP, that is jugular venous pulse. Check for pulsations over the neck. If it is evident in the sitting position, you need not check in the 45 degrees, but if you are not appreciating it in the sitting position, you need to make the patient lie in the 45 degrees and check for JVP. In order to confirm that, ask for tummy pain. I hope your tummy doesn't hurt. Press gently over the abdomen in the right hypochondrium and check for pulsations to confirm the JVP. This finishes the general examination. Next, moving to precordial examination is the second step of cardiovascular system. We go ahead with inspection. You need to inspect from the foot end of the bed. As you can see, this patient has a slight precordial bulge, which is evident from the foot end, which indicates a long-standing disease or a congenital heart disease. Also, carefully look for scars which might be there on the lateral, anterior or even posterior part of the precordium. Carefully look for the impulse and any other pulsations which might be there in the epigastric, pulmonary, aortic, suprasternal or supraclavicular areas. Next, going ahead with palpation, you need to remember 4 things. The apical impulse. Check for the apical impulse. Once you get the apical impulse, count from the sternal angle, the exact position. Also note the character of the apex. Along with that, also look for the other pulsations, epigastric, pulmonary, aortic and suprasternal pulsations. Also, you need to look for thrill over all these areas, that is mitral, tricuspid, pulmonary and aortic areas. The fourth, most important, carefully check for left parasternal heave. Keep the base of your thumb over the parasternal area on the left side. Look for a gentle lift which you might get in cases of left parasternal heave. You need to keep a minimum of 3 minutes for auscultating all the areas. You have the 4 basic areas, that is mitral, tricuspid, pulmonary, aortic, and there is a neo-aortic or the Earp's point, that is the left third intercostal space. So, you have to carefully auscultate all these areas for heart sounds, murmurs and any additional sounds. As you auscultate, please kindly remember to time it with the carotid. So, you need to keep the thumb or 3 fingers over the carotid and carefully auscultate all these areas. So, initially you can auscultate in the supine position with the diaphragm of the stethoscope. As you are auscultating, you can ask the patient to take a deep breath, hold and leave. Please remember to ask the patient to leave the breath. You are looking for, what you are looking for is the respiratory variation of the murmurs. As a rule of thumb, left-sided murmurs increase with expiration and right-sided murmurs increase with inspiration with a few exceptions. So, mitral and aortic valve murmurs, you will be hearing it better when the patient is in expiration, and tricuspid and pulmonary, you will be hearing it better when the patient is taking an inspiration or taking a deep breath inside. So, that is what you need to do as you auscultate these areas. And mitral and tricuspid, you can also auscultate with the bell. As you hear a murmur or a sound in the mitral area, ask the patient to turn to the left side and carefully auscultate the murmur or the sounds again. Also look for radiation of the murmur along the lateral chest wall. Can you please turn to the left side? All this while, remember to time with the carotid. Please. Thank you. Thank the patient. Once you are done with this, ask the patient to sit up. Can you please sit for me? Here, you are focusing on auscultating the pulmonary and the aortic area in the sitting and the leaning forward position. Can you take a deep breath for me? Hold, leave. Can you take a deep breath for me? Hold, leave. Once you hear a murmur in the aortic or the pulmonary area, you also need to check for conduction of the murmur along the carotids. After finishing this, you need to come to the back, auscultate the base of the lungs for any crepitations. Also, look for sacral edema. I hope your back doesn't hurt. Also, come down and look for pedal edema. I hope it doesn't hurt. This finishes the cardiovascular examination of the patient.